So good evening, I'm Randy Kearns and I'll be presenting our poster on COVID-19 and burn care in America. I have a quick presentation. Let me kind of scroll through that and then I'll come back to the poster and hit some of the highlights of it. Let me start by acknowledging our co-authors, Dr. Jeffrey Carter, Dr. Bill Hickerson, Dr. Colleen Ryan, Dr. James Jing, and Dr. Victor Joe. Let me be sure and note that we have nothing to disclose and no conflicts of interest associated with this particular presentation. So a little bit of history. We began collecting this data. We, as in the American Burn Association, began collecting this data. These data were collected from the end of March until early June, basically a 12-week period. It started in some cases before the pandemic began in certain parts of the country, but certainly started several weeks after it had begun in other parts of the country. And more than anything else, it gives us somewhat of a snapshot of how things evolved, at least during what we saw as the first wave of the pandemic. So if we look at total counts, again, there's about 128 burn centers in the United States. Of those, somewhere between 45 and 60 responded to these surveys each week. And then if we break it down a little bit further and look at where some of the surveys came from, we did include data from our friends to the north, Canada, but for the purpose of this work, the only thing that we focused on included data from the Northeast section, Eastern Great Lakes, Midwest, the Southern region, and the Western region. And I will note that as you can tell by this survey, or by these, by the yellow bar on the graph, people from the Southern region were more likely to complete the survey, and that's primarily because the Southern region is comparably one of the largest regions of the American Burn Association. And then we primarily focused on three key questions in the survey, and it dealt with staffing, supply, and space. Those are the three key elements of the crisis surge capacity and the crisis standards of care in terms of evaluating capacity for a crisis event. And certainly the pandemic has again revealed what a crisis event can be in the American healthcare system. So again, questions 3, 4, and 5 dealt with staff, supply, and space. So let's look at how that unfolded. Those were the questions, and these were the answer options. 2 and above was a mild problem not impacting care. 3 was a moderate problem threatening care. And then 4 and 5, obviously 3 and above was the break of where things were anywhere from problematic to significant. And as the main thing that you can see out of this, the supply line was substantially compromised. So these are counts, and then these are percentages of the respondents. This is probably the best graph to give you an idea of the total respondents, how many were reporting some type of a supply interruption or supply disruption. Early into the event, somewhere between 60 and 70% of the respondents were reporting supply chain disruptions. Now, by week 12, it had almost tailed off into 0%, but it does give you an idea of how much of a challenge we had, and we're behind the curve in supply chain management. And I would argue that even today, as we move into what's probably the third wave of the pandemic, that we continue to have some supply chain issues. Staffing was an issue, and as you can tell, didn't trail off nearly as quickly, and points to, once again, how quickly the healthcare system can be overwhelmed. And then space was never much of a problem, but again, we were measuring space only in the context of looking at burn care. And I've got one other way to look at that in just a minute that I'll bring out. And so people reporting 3 or higher, again, just remember 3 was a substantial problem. Again, these are counts, and then these are percentages of the respondents. So basically a third in week 1 were reporting substantial supply issues that was impacting care. And again, as you can tell, that tailed off by week 12. But again, I would argue supply chain management continues to be an ongoing issue, and then staffing, for that matter, at least in some jurisdictions today, is an issue, and in some cases a pressing issue. And so we concluded with a general surge question: are you okay? Or we've actually added some surge space, or we added surge space with tents or other facilities that had been co-opted and converted into usable clinic space or hospital space. And so we primarily looked at the answers of 1, 2, and 3. And this is the type of responses we had. Again, how many people, these were the counts, and then these were percentages. So yes, with tents, reflected a substantial number of people that had some type of surge capacity that they had co-opted by using tent space. And then the other one was surge space that they had already put in place. Again, by week 4, which was about the end of April, by week 4, more than a third of the hospitals that were answering the survey were using some type of surge space. And again, it reminded you just how significant, at least the first wave of the pandemic was. So let me wrap up with that. Probably the conclusion, and what I would add to this, let me go back to the poster itself. The main points that I would make about this reminds us that even though this was not a burn event, and certainly the pandemic has been quite challenging for the American healthcare system, it impacted and continues to impact our capacity to care for patients with a burn injury. And those of you who either have experienced this or are experiencing this right now, you know firsthand what we're talking about. And so what it really compels us to think about is, even though this is not a burn disaster or a burn mass casualty incident, it has and continues to impact our ability to absorb a significant number of burn injured patients, should we need to do so, just simply because of how taxed the American healthcare system is right now, as we continue to respond to the pandemic. I hope you enjoyed this. If you have questions, my email was on that last slide. It's rkearns@uno.edu. Also, feel free to contact any of the co-authors in the work if you have additional questions. Thank you so much for your time, and I'll see you later on Zoom.